My name's Andrew Solomon. I'm a health visitor. My job really is about supporting families in the community. Initially, when parents have children, we visit them at home and support those parents through the early years of the child's life and enhance the community health, really. What was I like at school? Gosh, you want the real version? At school, really, I was just probably, I think people would identify that as being Jack the lad at school. I listened to what the teacher said, but really, like to have a bit of a laugh and a joke, really. I liked enjoying the time with my friends and my mates. I left school really with no sort of real ambitions, wasn't really interested in what the careers advisor was saying, I went to work in a factory, and really enjoyed that really, but parents were saying you need a proper job, trying to stabilise, I think, a teenager. So at the time, I was going out with a girl, and her mom said, "Oh, you'd make a good nurse," and sent off for an application form for me. So I was 18 at the time when I started nurse training, and I was inspired really in children's nursing more than any other aspects of the course. I moved to Wolverhampton in work, and I applied for a job on a neonatal unit in the maternity services. I was working on a neonatal unit for a couple of years, but got a bit tired really of the shifts, the night shifts, the rotation, and left the NHS, took a job in the private sector. I really sort of just took the private sector as a job really. It was a salary. Met my current wife and needed to sort of settle down. The hours were more regulated. But really my passion that I knew that I had in working with children and families wasn't there. So I applied back to the NHS and took a job as a children's staff nurse. And at that time I took the job on, I went forward and done a diploma in children's nursing. One of the placements that we were seconded to was a health visiting team, and the health visiting team really, looked at a different focus of health really, and more on the prevention scale of things as opposed to the reactive treatment. That really sparked another spark inside of me, lighted another spark inside of me. So I went forth from doing my diploma in children's nursing, left and done my public health degree in health visiting, and here I am today, really, practicing as a health visitor, supporting families in their home that have got young children, and really looking at the wider community and the public health influences is on those. Having sort of health visited in an area that I was brought up in really, I've come across sort of families that I went to school with, and they've been quite surprised really that that's a vocation that I chose to do. But really enjoy my job, and and I get lots of sort of praises from old friends and current friends really in carrying on my passion really of working with children and families. When you're in the supermarket and families that you've had dealings with are coming up to you and asking you questions outside of working hours, you know that you've actually, turned that key and allowed that person a signposting direction to say, I can get support. And that's a good feeling really. So I don't think I'd, change my job. I think I'm at the point now, I know that I'm at that point in enjoying the jobs that I do. And I think this is what I'll do till I retire.